Right, I think we're live now. Okay. Right, no, let me just see people. Right, no, let me just see people. Right, no, let me just see people. Right, no, Right, Assalamu alaikum everyone. I can see that some people are joining. First of all, I'm really sorry for the delay. We're experiencing some technical issues. So for those available, could you please let me know if you can see me clearly, see my slides, and also can hear me clearly, please? Did anyone put any comments? Sorry, I'm not quite sure I can see this.
Yeah, they did.
They did.
I can see 2 comments.
So, all right. So, is my voice clear and the slides visible? Yeah.
Yeah.
Lovely. All right. Thanks, guys. So, we're just going to wait for more 5 minutes for some people to join, and then we'll get started. Okay.
Okay.
Right, so I think we can start now. So Assalamu alaikum again, everyone, and welcome to the Way to the Internal Medicine Training, or IMT Training webinar in the UK 2024. My name is Muna Murtada, and I'm one of the internal medicine trainee in London. At the moment, I'm doing my second year of training at Guy's and St Thomas's Hospital NHS Foundation Trust. And today, inshallah, I'm going to be one of your presenters, and I'm also going to be your main session moderator. I've also got with me other two lovely Federic trainee, and we're all going to take you through what the IMT application process is like. Please note, we're not intending today to speak about the IMT training in itself or what to expect inside your training is, nor speaking about other alternative, routes in details. So yeah, just keep this in mind. So if we actually start by a quick round of introduction. So as I said, we're going to be 3 presenters. So myself, and I've also got with me Hada Tahir or Hada Aziz, who's an IMT1, currently doing her training at University Hospital Sussex, NHS Foundation Trust. We've also have Reem Taha, who's an IMT2, currently based at Sheffield Teaching Hospital, NHS Foundation Trust. We are all University of Khartoum graduates. We are all international medical graduates. So more or less the sort of people that you might be able to relate to. Right, so in terms of what we are going to be covering today, so we're going to start by giving you an introduction about what is IMT, what are the eligibility criteria to apply for an IMT training, and then we'll speak about the IMT recruitment timetable. We're also going to take you through the application process and the outcome of this application process. And this is actually going to be the most bulky part of our talk today and the most important part to cover. So please do give it a particular attention. And then after that, we're going to take you through the interview process, including the results and the rank. And when we'll then speak about the preferences, give you some advices about how you make your way through them. And then we'll touch on the end a little bit on the IMT offers, and also got some closure slides. Right. So before we start, it would be worth saying that the main reason actually we're making this presentation at this time is, first of all, to give you an up-to-date knowledge about what the IMT application process is. And this is particularly important because this application process is actually variable from one year to the other. So you need to know what's new to make your way through it. And also because IMT nowadays is more competitive in comparison to previous years. We're also aiming to help as much international medical graduates, either Sudanese or non-Sudanese, who are intending actually to apply to the IMT training, either during this round or in future rounds, to have a better understanding about the process. And again, hopefully this will help them to secure a training number. Right, we are intending to run the session over 1 hour, which might be slightly challenging because we've got a lot of slides to cover, but we'll try to be as concise as possible. We're going to be communicating mainly in English during this session, and I do apologize ahead if this is, annoying for some of you, but we're really trying to cover a wider range of audience. This presentation will be recorded and saved on Sajda Facebook page, and also we're intending to put it on the YouTube at a later stage. So please do not worry if you don't make it to the live presentation today. We're also going to provide links along the way for all the website and the resources that we're going to be mentioned during the presentation, so don't worry about that as well. We're going to open the floor for some questions toward the end of the presentation, and we'll also try to, answer some questions along the way. So please, if you do have any question, just put it on the chat bar and we'll get back to it. But it would be worth you saying, if I can just advise you not to post questions early during the presentation. And one reason for that is we might actually cover your question while the presentation is progressing. So if you avoid doing this, it will help us to make the presentation more efficient and organized. However, if you think that we're approaching the end of the presentation, we still did not cover your question or anything is not clear, please post it and we'll be happy to answer it if you've got the time and the knowledge, obviously. Also note, maybe for time reasons, we might not be able to cover all the questions, but don't worry because we're actually intending to revisit the post at a later stage. Right. Lastly, a disclaimer, all the presenters today are only representing the Sudanese Junior Doctor Association. We're not here today representing the GMC. We're not here today representing any other NHS Foundation Trust, and all the materials and the example that are going to be used during the presentation will be for educational purposes only, and they're not going to be linked for a specific candidate. So without any further delays, I'll leave you to start with our first speaker today, Reem Taha. All right.
Thank you, Mana. Hello, everyone. I'm Reem Taha. I'm IMT2 in Sheffield Teaching Hospital. I'll just share my slides. In Sheffield Teaching Hospital. Okay, so today I'll be talking about what's internal medicine training, the eligibility criteria for internal medicine training, and a quick overview of the timetable for IMT training. So, internal medicine training is the primary entry point or initial stage for training career in the medical specialties in the UK. It could be either 2 years or 3 years training program, depending on your intentional subspecialty in the future. These years are individually variable in terms of type and length of rotation. It could be either 4 or 6 month rotations. However, internal medicine training will give you a wide exposure to wide range of medical specialties. Clinical care medicine and geriatric medicine are mandatory rotation in all internal medicine training posts. Upon successful completion of the internal medicine training, the trainees will be able to apply for higher specialty training programs in the UK. Okay, so the subspecialty training pathways in the UK, there are two different types of subspecialty training pathways. It's either uncoupled or run-through pathway. Run-through pathway involve only one application in the beginning, and then you will have a full run-through training until you have the completion certificate of training. The uncoupled training, it will require two applications. The medical specialty trainings are uncoupled training, which means that you will need to apply for core training, which is now known as internal medicine training, and then reapply again for the higher specialty training, which makes it a bit competitive and could be challenging as well. The medical specialties are divided into two groups. Group 1 specialties are the groups that are support the acute hospital care, like acute internal medicine, gastroenterology, endocrine and diabetes, geriatric medicine, respiratory medicines, and other. These specialties will require 3 years of internal medicine training and full membership of MRCP before applying to the training. Group 2 specialties are the specialties that are mainly provide non-acute and outpatient-based services, such as allergy and immunology, dermatology, hematology, clinical and medical oncology. These specialties require only 2 years of the internal medicine training and completion of MRCP membership before applying for the higher specialty training. Our presentation today is mainly about the internal medicine training. However, there is another pathway for medical specialties called Acute Care Common STEM Internal Medicine. This is a 4-year program. The initial 2 years of this program will normally spend, the trainee will normally spend about 6-month rotation in emergency medicine, acute medicine, anesthetics, and critical care medicine. By ending of these 2 years, the trainees should complete the ACCS curriculum. The 3rd and 4th years are equivalent to IMT2 and IMT3, which will be either 4 or 6-month rotations in general medical specialties. And by completion of the 4-year, the trainee will be able to apply for both specialties group, type 1 and type 2. And by completion of the 3rd year only, the trainee will be able to apply for Group 2 specialties of the internal medicine. Okay, now we'll talk about the eligibility criteria briefly. The eligibility criteria divided into 2 groups, the entry criteria and the selection criteria. The entry criteria includes the qualification to have an MBBS qualification, to have a GMC registration with license to practice at the time of the starting date of the post. So you can actually start the application for internal medicine training while you are in the process of doing the GMC registration. You don't need to have the GMC registration at the time of the application, but you need to have it at the time of the starting date to demonstrate evidence of achievements of foundation competences, which means either to complete the foundation program or to have the CREST form, which I'll speak about it in the next slide, to be able to work in the UK, to show fitness, to practice safely, to demonstrate career progression, and to complete all the sections of the application. The selection criteria requires essentially to be qualified doctor with MBBS and desirably to have MRCP Part 1. Also to have the ability to apply the clinical knowledge and judgment to problems and prioritize the clinical need, to have academic skills which demonstrate understanding of the research, the basics of the quality improvement project, and evidence-informed practice as well. Personal skills like communication, problem solving, decision making, vigilance, and situation awareness you have to provide evidence of professional integrity and commitment to the specialty. You can find more details about the eligibility criteria in the attached website link. The CREST form. This is the important part. The CREST form is the Certificate of Readiness to Enter Specialty Training form. This form should be signed in advance. So you have to have the CREST form signed in advance to the application. You will not be able to proceed in the IMT application if you don't have the CREST form. It cannot be submitted retrospectively. You have to make sure that you have the most updated version of the CREST form. It has been updated, it's being updated every couple of years, so make sure that you have the most updated version of the CREST form. It needs to be completed by the consultant who supervised you for a minimum duration of 3 months in the last 3.5 years. And this professional consultant, if he's not GMC registered, you need to be able to provide adequate evidence of professional status of any signatory to be scanned and translated if it's not in English. Make sure that you read all the CREST form checklist. Make sure that all the pages are signed. Make sure it's signed correctly before applying to IMT training. Okay, so now I'll just give you a brief timeline, a brief talk about the timeline for the internal medicine training recruitment in 2024. Before that, just to let you know, it's a single process covering all the UK programs. So there are about 1,600 posts. These posts cover both the internal medicine training and the acute care common STEM. You need only one application to apply for both specialties, and it's only one round in a year. And the program this year will start, the next program available will start on the 7th of August, 2024. The assessment process is self-assessment, shortlisting, and online interview, which will be covered thoroughly by my colleagues Hala and Muna. And if you need any further guidance about the internal medicine recruitment, you will find further details in the attached website link. Few tips before your application. Plan your application in advance. What and where? What do you want to apply for? Do you want to apply for ACCS internal medicine training post, or both of them? Do you have any preferences? Do you have any rotational preferences, any specific specialties that you would like to have during your rotations? Do you have any specific regions you would like to work in? So you have to think about this in advance. Make sure that you are aware about the dates of the opening applications and the deadlines. And all this process is done through the ORIAL system, and Hala kindly will give you further details about the ORIAL system. So the application will open next Thursday, in 26th of October 2023. Closing date is at 4 p.m. on 23rd of November 2023. Make sure you submit your application at least one day before the closing date, just to avoid unfortunate circumstances. There will be a long listing confirmation email sent by the 19th of December. If you're eligible for the internal medicine training, you will get an email for the shortlisting, which will let you know if you're appointable for interview or you're in the waiting list or unappointable by the 20th of December. And the post will start on the 7th of August, 2024, inshallah. So now I will leave you to the most important part of our presentation, the application process, with my colleague Hala, and good luck, everyone.
Thank you, Reem. I'll start my presentation now. Can you see my slides? Can you hear me and see my slides?
We can hear you, but we can't see the slides.
Okay, this is sharing. Let me know when it appears in your screen.
Fine. So people on Facebook can also hear it clearly, so that's fine. We're just waiting for the slides. It seems like they're loading. So
Okay.
yeah.
Should I try again?
It's all right. Just give it some time. Don't rush it. If you want, Hala, share the slides for you. Would that work?
Yeah, that would be
Right.
fine.
Be more about sharing your
There
screen.
seems to be much today.
Thank you.
Okay, Hala, I will share the slide. Just let me know when you want me to move.
Okay, thank you, Reem. All right, sorry for that. Hello, everyone. I'm Hala Tahir, and I will speak with you about the application process, and I'll give you some template examples. Next. So the application process consists of two steps. One, you need to create an Oriel account, and the next just to fill an application form and submit it. And that's all you need to do. But we'll take you through the application form just to give you an idea before the time, because this will help you as well in planning. And I would also encourage you, even if you're not applying this year, to open the application form and have a look. I have some screenshots from the previous year application form, so that might give you an idea, but also have a look at the new form. There might be some changes, but they probably likely look similar. Next one. So the Oriel system is the UK-wide portal for recruitment for medical, dental, pharmacy, public health, and healthcare science postgraduate. It's where they will publish the vacancies, and then you'll be able to choose and apply and fill the forms. The Oriel was updated in October 2020, just in case if you have had an Oriel account before this time, you'll need to create a new one because all previous accounts have been lost. So you'll just take 5 minutes to create a new account, and the guidance is fully explained in the IMT recruitment website. I will not go through it because it's a pretty straightforward process, and we'll focus today on filling the application form. Also, when you create your account, you will have an access to the Oriel Resource Bank. Well, you will have more documents and of guidelines and the CREST form, and all these documents will be available in your resource bank. Yes, so this is how the dashboard look like. I'm sorry, probably you'll not be able to see my cursor. So if you can just point, Reem, please, for the parts in the left side, you'll have the dashboard, the vacancies icon, the resource bank where you'll have access to the resources. And on the top there is documents, applications where you will be able to see the applications that you have filled, your preferences. When the preferences window open, this is where you will be able to access the preferences to rank them, and you will have a message that's the communication with the recruitment leads, our team, and the interview section where we will be able to book your interview when the time comes for the interview booking, and the offers that you have been offered, and finally your references. So let's go to the next step. Then it will be where you can find the vacancy. So click on the icon for vacancies. It will be the next slide. Then you will search for internal medicine training CT1. This is how it will look like. This is the application for stage 1 internal medicine training. You will click open the form so you can open it and start filling. Okay. The next is when you open the form, you will find out it is it consists of 5 main parts, or the first one will be containing personal information and questionnaire of about equality and diversity information and your employment history. If you can click green, please, for me. Yes, in the person you will add your contact information, your immigration status, and visa. You'll answer these questions for the next questionnaire, and at the end, the employment history. Also, the employment history is straightforward process. You will arrange your posts, and then the application itself will generate for you the employment gaps according to the post that you have worked before. And this is where you will be able to enter the reason for each gap you have in your employment history. But also after that, if you have additional gap, you will have a place where to add or answer questions about more gaps in your employment history. Thank you. The next part of the application form consists of 5 pages. The first is about training history, previous training details, and also some questions about your personal circumstances. Whether you have any disabilities that would make you request more support or adjustment of your assessment or your interview. So you will have a space to declare that in this part of the form. Also, if you are considering less than full-time training, and this is just to answer these questions. That doesn't, you will need to do further steps to apply for the less than full-time, but it's just to answer these questions to help the recruitment team to plan. Then your professional registration details, the GMC numbers and all that. If you are new to the UK, also this will just to help to give you support when you start the training, your language skills, your English proficiency, and if you have any special circumstances that you will need to be in certain geographical area, you will be able to declare that or just say it in the application form. And if you wish to apply for a deferred start date for any reason, any planned things in your life. So the next page is about the references. And this is really important part as well, because you'll need to provide contact details of 3 referees. These are your supervisors that you have worked with in the last 2 years. And one of them should be the most recent one, and or your current educational or clinical supervisor that they have an idea of your clinical development. It's important beforehand to ask them whether if they are happy to provide you with reference. and explain to them what they will expect. They will receive an email from the recruitment lead, and also ensure they will be available to answer these emails at the time during the application. So maybe give them the dates that when the application process will start. So we're not sure when exactly, but they might send it after the interviews. The next is about fitness to practice. This is another questionnaire as well. I'll not go into details because it also depends on special or personal circumstances and personal answers. Okay, so the next is about the competencies and eligibility. And here you will answer questions about your foundation competencies, whether you have completed a foundation program or in the UK, or if you have completed a training program that was equivalent, or you can provide an evidence from it for your foundation competencies. If not, this is where, which will lead you, if you haven't, to be able to upload your CREST form. So the next, or down in this form, when you answer these questions, it will ask you whether you have your CREST form to upload. And then next, you will be able to upload your CREST form here. Make sure you name it and upload the right type of document. And this is needed to submit the form. As Reem mentioned, you can't proceed and submit the form before uploading this document if you're answering to the question requiring you to upload the CREST form. Thank you. Next. All right, so the third part of the form is about supporting information, but I'll speak about the self-assessment score, our scoring system, or self-scoring, before the supporting information, because I feel it will be the base to how you then explain and give your supporting information. And this is also one, or we can say the most important part you need to know about, because this score is the score that you will compete by with the other candidates to secure an interview slot. They will have a certain interview capacity, and they will take people according to how they score on this score. So the categories that you can score yourself for in this system or scoring table is the postgraduate degree and qualifications, your additional achievements, like awards that you have been awarded at any clinical or academic post, or during your studies. If you have done any presentations or posters, if you have any publications, your teaching experience, your training in teaching, and quality improvement projects, and if you have any leadership and management experience. The total score is 40, but as we said, the minimum score wouldn't be something that we can say now, because it will depend on how other people would score and the interview capacity. But you will do as much as you can to get a maximum score. And it's important as well, equally important, not to overscore yourself, because this will lead to unpleasant circumstances and will put you in trouble. And also not to underestimate yourself and your achievements. So be careful in what you score yourself with, and if you are unsure, you can ask your supervisors. We'll go into more details about each category, just to give you an idea how maximum score would be and how the minimum score would be. In the postgraduate degrees, it depends on what degree you have had. And just to mention, this doesn't include the full membership exams, because or any membership exams, because it will come in another page to talk about, and it's not included in the score. It will give you, or it will just to represent that you are committed to the specialty. Additional achievements, yes, these are the achievements that if you have had it during your primary medical qualification, during medical school, if you have these during any event or any international achievement. So depend on what you have granted, you will be able to score yourself. And you can read more extensive guidance about this in the website. Next, please. The next are the presentation and posters. You will think about your achievement in two ways, whether this was local, national, or international. And also whether this was a poster presentation or oral presentation. And depending on that, you will score yourself. And it's clear the maximum score, I think it stays. Doesn't say, but I think it was 7, yes, and the minimum would be 1. For publications as well, it depends whether you have been a first author, a joint author, and you will see which category you'll be able to score yourself with. The highest is 8 and the lowest is 1. And you can see there are good range that you can achieve if you have any publication. And also depending on the journals that you have published with. Then coming is the teaching experience. And it's important to know that what can give you more scores in your teaching experience. The first one is, or the highest score you can give to yourself if you have organized a teaching program and you have taught on it approximately 3 months or longer. And this might not be achievable if you want to start this now because of the time limit. But of course, if you are planning to apply next year, this could be something that you could think of. The next is if you have been, for example, employed in a teaching institution and you've been regularly teaching medical students or colleagues a course or any defined program, you will score yourself 3. And the lowest score, if you have just occasionally taught your colleagues or your medical or any medical students, whether while you're working in your clinical unit or clinical post, and just make sure to collect feedback. And we'll talk about the evidence at the end as well. Training in teaching, there are some levels of training that you could score yourself for. The first one, the master level, and that would give you highest score. And if you have any other higher qualifications equivalent to postgraduate certificate or diploma, that would give you a score of 2. And if you had a training in teaching less than that, for example, a course, that would give you a good score of 1 as well. So that's, I think, something that could be achieved in this time before the application window, or before the closure of application window. That's something that you could do, a course for teaching or training. These are some examples of teaching courses that you could apply for and have the certificate. This one is in the FutureLearn website. And the good thing is if you are NHS employed, you will have free access to the certificate. It's a bit longer, it's a 5-week course, but it's by the Health Education England. And also if you are, as I said, employed in the NHS, you will have the certificate. The next is, this is another example. I think this one is the 3-day course. Is it green? Yes, I think so. Oh, 2-day course. This is a bit shorter. That can be done as well. Another example in the next slide is, I'm not sure, that's this 3-day course, I think, yes. So some of these, these courses, we can't really say recommend one on or over another, but you will choose what suits you and if there is any availability and what you want to do. But these are just examples. You can do other courses as well, just to improve your teaching skills. The next is the quality improvement projects, and you will score yourself according to the stage that have been completed in a project and your contribution in the project. And lastly is the leadership and management experience, whether you have had national or regional leadership role, or if you had a local one. These are just 2 levels to score. Thank you. Then we will go to the supporting information. Here will you be able to provide evidence, but by evidence, we don't mean documents. The evidence here provided is just statements that you will write and express and explain yourself and just talk about your achievements that you use to score yourself with. And in this part, you will have more questions about the postgraduate, about the presentation. And if you don't have anything to say or you have scored yourself 0, you can just write non-applicable. Yes, you'll talk about your presentation, what you have done. It's just part of, or we can say a reflection on what you have done in this particular presentation. If you have many presentations, just choose one. If the one you have used to score for is an international, then choose, of course, the international one and talk about. Also about the publication, you'll be able to talk about if you have published any. Then talk about teaching experience. What was your contribution in this teaching experience? So just read the questions carefully, and this will help you how to express yourself, and make sure or try to use strong words to make you stand out, because I think it might not be just simply to say what you have done, but just make it more representing of what you have done, as what special was done by you and what was your impact, and what things you have made differently. The next is collect the teaching feedback. So this is where you can, how you can collect teaching feedback as an evidence. If you have done the teaching occasionally, this is a good tool to use. This is one of the examples. There's a form available in the JRCPTB website. You can download, print, write your name, write the session details, and give some copies to your audience or attendees, and then ask them to provide the feedback. Scan them, get them in a PDF. That's your evidence. If you have been working in an institution, ask, get your certificate of experience, and that will be your evidence. The quality improvement projects as well, you'll be able to answer what you have contributed, what things that you have done in this particular project. And just make sure to know about the project, even if your role was part of it, because they might ask you more about it in the interview. And then will comes the leadership and management. Yes, you will explain your role, as we said, but make sure to speak about your own impact on this role, what you made differently, and how you have been a good leader in this role. This is an example of one of the candidates. So we can see here, the role was a chief organizer in examination for the Internal Medicine Board. And I think the candidate has spoken that how they have organized the team, how they have also used tools for communication, how they have organized the same day of the exam, and also the support and training for improvement of the team members. I think this is a good example of leadership, and you can also use your own examples and your own words and your own experience. Just make it stand out and clear. The next is, so you remember the supporting part of the application was evidence and supporting, and this is the supporting page. It's about your MRCP exam, and it says clearly that here this area will not be scored, and it will not also affect the entry requirement for IMT, but they will use that as well in just to show that you have a commitment to the specialty. And this also applies to the next part of this page. You will be able to speak or write things that how you are or why you have chosen this specialty, why you have chosen internal medicine, why you are interested in this training program, and what your future aspects. I think these things that could be included in these boxes. And the next is, what have you done? What have you done to prepare to the internal medicine training program? You have mentioned many achievements already, but you can also highlight them or mention more things that you have done to pursue this training program. You can also, I think, summarize them in clinical, academic, and in terms of quality improvement projects. Then you'll be able to talk about your training courses that you have attended, what training courses could support your application and show relevance, show commitment, any medical courses that are relevant to medical specialty, ECG course, ALS course, of course, critical care courses, also the healthcare trainer or the teaching courses, that these are relevant courses. You will have four slots, I think, or 4 places to talk about the courses, but also you will have more space to talk about if you have more courses that you want to show you have done. Thank you. So the top tips at the end, just ensure that every achievement you mentioned is completed at the time you submit. Make sure you have the evidence in your hand, and that's very important thing. It is completed and done. You are not, for example, now studying for this degree. You are not now working on this project. No, you have done and completed this, and you have got your certificate and your evidence. And you'll find more information about what evidence are required for certain projects or certain achievements in the website. But also, if you're not sure, ask your supervisors. Also, while you are filling the form, save as you are writing in the application, because it might be lost if you haven't, because there is a time limit where the application will be open. You might take time just expressing yourself, and then you might get, you might lose everything if you haven't saved. And don't leave things for the last minute. To make sure you submit that, as you said, by maximum more, at least 1 day before the deadline. And revise before you submit, because once you submit, there is no chance to amend the application, and there will be no exception as well for the deadline if you have been delayed. And also, I just want to mention one more thing about the evidence. So the evidence I've talked about, the documents, you'll be able to, you might be asked to provide these documents as part of randomized audit, or in case if there is any concerns arise from your or regarding your application. But that's why you need to keep them ready in hand. And otherwise, the only evidence or the only document you need to upload is the CREST form, if needed, of course. Yeah. Next. Is it too late to consider IMT? I think it's not. You still have chance. You still have time before the deadline. Things that could be achieved, like a small QIP project that you can finish before the deadline, that could support and increase your score. You can do local teaching as well. You can do that and collect the feedback. You can also present in any local or regional meeting and then get your certificate. You can also, what you can do as well, maybe look back in your past, what you have done in the medical school, see what you can get evidence for, ask people, ask your previous supervisor. I think it's not too late to chase your evidence. Just try your best. I know it might be difficult in situations now in Sudan, but maybe try. Refer to the website as well for any further details, what kind of evidence you might need to provide, and be positive. You are walking steps towards your application, even you haven't made it this time or this year. You have already made steps, you have known things, and you will be ready next year. Yes, just start. And thank you. I hope this was useful. Also, before I close, before we go to the next stage, we'll talk about outcome after you submit your application. So the outcome you would expect, an email say that you have been eligible, and this is the long listing stage. Then you will expect whether you have been appointable or not, and this means that you'll be invited to the interview if you are appointable. The next email will be the invitation to the interview. So when you are appointable, just have a look at your schedule, make sure you have in your mind the preferred interview date, or give yourself some backup, so then you will be able to book a good time for you and good time to prepare with. I think also Mona will talk more about how the interview slots are advertised or are published, but just wanted to mention one thing. Where you will do your interview is not a big deal. If you find a date in another area that you don't want to go to, for example, that doesn't matter, because it's just a recruitment process and they will do the interview the same way if you have been in another area, and then you will be able to apply for your preferences to get the preferred place for you. And that's it, I think, on my part. Thank you very much, and we'll give the mic to Mona.
Thank you so much, Hala. So let me just share my slides. Right, so can you guys see my slides? Can you?
Yes, yes, we can.
Oh, yes, we can.
Oh, why did it start from here? Sorry. Yeah. To the interview part. Right. So hi again, everyone. So the next step is going to be the interview. So just remember, the interview is the second sort of assessment in your IMT application after the self-scoring. And if your application has deemed eligible, which means you've been longlisted and you've scored high enough to be shortlisted, then congratulations. That means you will get an invitation for the interview. So according to the IMT recruitment timetable, these invitations will be sent around the 21st of December, 2023. And these invitations, as Hala said, will be sent through the email, and also they're going to be in your Oriel account. So what does that mean is around that date on the 21st of December, if you need to check your email, and if you don't have an invitation, do not assume that you haven't been invited, especially, so the shortlisting result will be 1 day prior to that. So if you received an email that you've been shortlisted, certainly you should receive an email for invitation. So go and check your email thoroughly, including your junk email, and also make sure to check your Aurea account. And this is actually quite important throughout the process, not just in the interview. Always keep an eye on the IMT recruitment timetable, your emails, and your Aurea account. So this is just an invitation for the interview. So you need to respond to that invitation. So you either accept it, you either decline it. I'd assume you would accept it. And if you accept it, then you have to book it. And this booking is on a first come, first serve basis, which means you will need to hurry, especially if you have an intended date in mind. Also, please be mindful about the deadline for the response of this invitation, because if you miss that deadline, your invitation will be withdrawn, so you will miss your opportunity. In terms of the interview type, all the interviews post-COVID, IMT interviews post-COVID are conducted online or virtual, which means that you don't really, which is more convenient because you don't really have to worry about traveling to your interview place or having the stress from the direct in-person contact with the interviewers. Also remember, all the places in the UK, UK, there are 4 countries, so Wales, Scotland, Northern Ireland, and England. So all these areas of the UK, they do usually host the interview. Does that matter? Does that add any significance to your interview? Not at all. It really doesn't matter where you will have your interview. And remember, the place or the generally where you will be having your interview online does not mean that this is the place where you will be having your IMT training in the future. Okay, right now, sorry, just give me 1 second. Right. Now, the interview structure. So when you think about the interview structure, please think of it as a consistent process. So the interview structure is consistent for all the applicants, which means that it follows the same exact format and it covers the same areas of assessment. So broadly speaking, the IM2 interview structure is divided into 3 stations and approximately lasts for 25 minutes. And usually you've got 2 examiners. And these 2 examiners or these 2 clinicians will contribute to your assessment score. And there's also going to be 1 member from the admin team just to help run the interview. Now, the first station in the interview structure is application and suitability, which is 6 minutes in total, including 2-minute presentation and 4 minutes question. I'll come to explain it in a bit. And then the second one is a clinical scenario and a handover station, which is the longest. I think it's 11 minutes or 12 minutes in total. So you've got 3 minutes to read the scenario, 8 minutes for discussion, and then 1 minute at the end for the handover. And then you've got an ethical scenario, or what we call it, a station where you've got a scenario that covers either an ethical, professional, or a clinical governance aspect, and it's a 5-minute station. Right, okay. Right, so let's start with the first one, the application and the suitability station. So this station, I want you to think of it as the most important station in your interview. And the reason for that is because it's accounted for most of the scores, so it's nearly accounted for 53 or 50% of the total score of your interview. So it's really important. So if you nail this one, hopefully you will nail your interview in total. So it starts with 2 minutes narrative, where they give you 2 minutes and they ask you to speak about yourself or take them through your CV. This is actually new. When I've done my IMT interview, there was no, this 2 minutes were not there on the interview. I think it's a good thing and it's a bad thing at the same time, because I feel if they give you 2 minutes to speak about yourself, so now you know what to expect, so you can prepare for those 2 minutes. But then at the same time, and sort of you will be having more control of your interview. But then at the same time, these 2 minutes are certainly not enough to cover your portfolio or cover all of your achievements. So you need all of your achievements, sorry. So you need to be very, very smart in the way how you will deal with these 2 minutes. I'll give you some tips. 2 minutes is meant to sell yourself, so make sure to sell yourself in a good way, and that's we need a good preparation and good communication skills. Cover your area of achievements up to date in a way that you sound proud, and also think about the relevancy. And when I say relevancy, do you remember the eligibility criteria, the essential and the desirable for the IMT that Reem was talking about? Go and make sure that you read these person specification criteria and try to find areas in your CV, that demonstrate that and speak about it in the 2-minute presentation. It's totally up to you how you want to speak during these 2 minutes, either in a chronological order or either just on, what you think is more reliable, sorry, relevant, and sounding more, big, if that's the word. Right. Make sure to prepare. You really have to prepare, but don't revise stuff. So to avoid sounding scripted, try while preparing to think about a clear structure for your interview. So I'm so sorry for the background noise. So try to think about a clear structure for formatting these 2 minutes, and then practice ahead to sound natural. So when practicing, it doesn't mean that you have to practice with someone who's medics. You can practice with yourself, just, time yourself for these 2 minutes, write it down, and then time yourself, or maybe practice with your friend, or maybe a medic. It's totally up to you, okay? So after these 2 minutes, you will be expected to ask questions, and it's going to be 4 minutes. So these questions are non-clinical, non-ethical questions, so they are generic or generic questions, so expect anything. There might be questions about academics, so why IMT? What is the IMT curriculum? What do you know about the NHS struggles, for example? This is a very generic question. Or they might ask to explore more on your achievements, the one that you've put on your portfolio, mainly, not necessarily you've mentioned them in the 2 minutes, but anything that you've mentioned on portfolio. Let's say you've mentioned that you've had a QIP, but you haven't actually touched on it in the 2 minutes. They might actually ask you to speak about it more. They might ask about your career aspiration, your personal characteristics. So what are your weaknesses, your strength? How do you deal with your stress, and etc. So yeah, anything can come really in this 4 minutes. So try to make sure that you're well prepared and you anticipate those questions ahead, so you have an answer in mind. And I'll let you know in a bit how you can prepare for that. We spoke about this, what's important. This is the bulk of the marks. So the second station is the clinical scenario and handover station. And this one is, when you think of it, please don't be scared. And it's just a very classical kind of medical scenarios, nothing new, nothing big to expect. And it's a very, very doable station. So the scenarios can vary, can be acute medical cases, or acute medical emergencies, or non-acute scenarios. So the setting would be either an ED department, you on the ED department, or you on an outpatient setting, for example. It doesn't really matter. But I'm just saying, most commonly you've got acute scenarios. So the main, I think, assessment area that they try to assess during this station is your safety as a junior doctor and your level of escalation, okay? Whether or not you're safe, whether or not you know your limitations when you don't know how to deal with the station. So try to sound safe, try to sound someone who knows his limitation, in other words, know when to ask for help. So it starts, they give you a clinical vignette where there is a scenario, and then they give you 3 minutes to read. You can take notes during these 3 minutes, and obviously you cannot Google or, have a look into a book or anything. But this 3 minutes is actually, I think, enough time for you to navigate the station. My tips during this 3 minutes, try to think about your approach, okay? How are you going to approach this station? Try to think about differential diagnoses, try to think about the management plan, and all the answers that will be expected. And then you will have 8 minutes for discussions. It's not a role play, it's just a Q&A kind of format. So they will ask you a question. They probably start by, okay, what's your approach to the process? To the scenario. And always top tip, say my approach is ABCD approach. So AT approach is the safest approach. It makes you sound very, very safe junior doctor, and then take your way through the differential, investigation, and management. And they will give you 1 minute to hand over your case to the medical registrar, because this is typically what happens here in, you know, in day-to-day life or clinical basis. So as a junior doctor who meet the patient for the first time, you will need to stabilize the patient, and then you will need to involve your seniors, and probably the next level of escalation would be your medical registrar. I'm not going to go in details into how you're going to do this handover, but there are a lot of approaches to how to do your handover. The most common one is called an SPAR approach, where S stands for situation, BAR stands for the background, and A stands for action, and R stands for the recommendation. I'll leave you to read it really and go through it during your preparation. This is a bit out of the scope of this presentation. I've got an example here. So let's say that this is the example. You've got a 78-year-old male with a background of long-term urinary catheter who presented to the ED with confusion. They gave you the vital signs, so hypertensive, tachycardic, tachypneic, and feverish, and they said you've been asked to see him on the medical take. So you're the SHO on the ED department, and they've asked you to see the patient. So during this 3 minutes, as I said, you need to start thinking about your approach. Also, they usually include the vital signs in the scenario all the time, just to sort of give you an idea whether or not the patient is stable or unstable. So as you can see clearly, this patient is unstable. So if you can spot the diagnosis, fine. If you can't spot the diagnosis, please don't worry, just go very systematically and don't worry at all. So the diagnosis here, it does sound like the patient have a septic shock because he's feverish, and it does sound like this septic shock is coming from a urinary source because he's an elderly with a long-term urinary catheter. If you got it, you got it. If you don't got it, just say, I would like to start with an ABCD approach, make sure the patient is stabilized, and then they will ask you about your differential diagnosis. If you can think about something, fine, say it. If you don't, then please don't say nonsense that might jeopardize patient safety. Please don't do that. Just be safe, be honest, say, well, at this stage, it's not very clear to me what the diagnosis is, but I make sure that the patient is stable, and I would like to involve my registrar, or I would like to involve whoever, you know, available. I would like to ask for help. Okay. Right, let's go. So the third station would be the ethical, professionalism, and clinical governance. It's a 5-minute station, and so usually a single question station. So they will ask you one question covering either an ethical, moral, or a legal aspect. It's not very I mean, it's not difficult. It's not very difficult, but it might be challenging as well, because there is a lot of communication skills here. You know, you need to be having good communication skills rather than a knowledge, in my opinion. So ethical scenarios can be anything from dealing with reluctant patient, difficult patient, medical mistakes, confidentiality, consent, the capacity assessment, what else, breaking bad news, you know, legal issues can be a safeguarding, maybe, yeah, so safeguarding, clinical governance. So the clinical governance, that's something that they really like here. Make sure you familiarize yourself with the concept of clinical governance, and it's actually part of it's a tiny part of the interview where you can sound scripted. I mean, you can just revise it, and if they ask you, just, you know, say it. Sorry, again, is misspelled. So yeah, again, patient safety is priority. So they will need to ensure that you're a safe doctor and you know your limitations as well. Always do not forget to also, you know, involve your seniors. And when it comes to ethical scenarios, your seniors are not just the registrar. Even if you think that you've got the capacity to deal with the situation, always say, because it's an ethical scenario and it's a sensitive issue, I would like to involve my seniors early, or I would like to involve the senior nurse, for example. You know, just try to think about people in the hospital that might help you to speak with those patients or to deal with this scenario. Right, then how can you prepare to the interview? So there is no right or no when it comes to the preparation of the interview, which means that whatever you think is possible is going to cover the area that we spoke about, you can do it. But I can just give you some advices from my personal you know, experience and the experience from the people around me. So start with warming up. Read about the interview in details. Try to orient yourself more about the assessment criteria, the type of the stations, the length of the station. And for this, the most recommended book is this book, in the top right of the screen, medical interviews. It's not a book that's specifically for the IMT trainee. Anyone can use it, even non-trainee, they use it usually to prepare for their interviews. It's a quite heavy book, very boring, to be honest, and I only recommend to read it. Don't study it at all. If you feel like it's boring and you can do it with a group, I highly recommend you to read it with someone. Just go through it so you're familiar with it. It will give you approach for most of the generic questions. So how to cover when they ask you what is IMT, tell us about your strength and, you know, and for example weaknesses. And it also touched a little bit on the ethical scenarios. So it's a really good book to read, okay? Then secondly, on the preparation, from my opinion, try to cover the medical cases and the ethical scenarios, the most common, you know it, just try to go and refresh your knowledge. So medical cases, I would stick on preparing only the medical emergencies. You're not going to be able to cover all the medical cases. So try just to cover the medical emergencies. And again, it's totally up to you. You can do it from books or you can do it from websites that provide a sort of, a question bank for the interview. So the book that I used myself personally was the Oxford Clinical Handbook. It was really, really good. Towards the end of the book, there are pages where they speak about the medical emergencies. It's really good. It's up to the to the point, so make sure to cover it. But if you don't like to read, so I would recommend Medibody. Again, it's a very, very good website. You have to pay for it though. It's quite expensive, so yeah. But what I like about Medibody is actually cover the interview in a way very, very similar to the real interview environment. So give you start by giving you the question and then the answers and even the handover. They'll tell you how to do it. So it's really good. Highly, highly recommended. Lastly, but not the least, and the most important part of the preparation, from my opinion, and that most people actually forget about it, is your own application form. Please do not forget that during the interview. So the first station we said that account for 50% of the mark is the application and suitability. And as the name implies, they're just trying to see if your application was relevant, further relevant, because they've already assessed you on the self-scoring and your suitability to the role. So part of the things they will ask you might be on your application form, and you might actually forget what you wrote. So just go and try to make sure that you know your application in and out. One thing that you really want to avoid, that you come to the interview and give the interviewers the impression that you actually claimed something in the application that you don't sound or you don't look like you've done. Okay, so keep this in mind. Is scoring and assessment of the interview. Honestly, I'm not gonna go into details. So I just wanted to know that it's a quite fair process. As I said, two examiners or two clinicians, they will both be participating for your scoring assessment, and there will be a clear assessment areas to be covered. You will find them on an extensive guidance for this on the IMT recruitment website, so you can go and read about it. Just remember, the first station count for most of your marks. So in other terms, it might sound like if you have a good portfolio, you might nail your interview, but it's not the case, basically, because it's not just about your portfolio. It might just have a very basic or standard portfolio, but you have a very good communication skills, you know how to sell yourself, so that's really count. Also, please remember, good communication skills doesn't mean good English. So so even if your English is not good, even if you're not naturally well spoken, practice makes perfect, and try to think about your tone, your how clear you sound, how confident you sound, and all the other communication skills. All right, remember, so again, interview, very doable, nothing new or big to expect. Do not be scripted, please. Try to be as natural as possible. If you someone who likes study groups, so consider study partner early if interested. I think not because the interview is difficult, but I think always give yourself a good time to prepare ahead. So maybe 1 week or 2 weeks ahead, or maybe 1 month. I'll leave it to your own, judgment. But I think a gradual, slow pace approach is advisable, especially when it comes to reading the interview book, because as I said, it's very boring. So yeah, so you don't want to, give yourself an unnecessary stress at last minute. Lastly, as well, consider the interview environment. It does sound like this is logical, but a lot of people forget about it. Please don't forget to be polite, dress well, on time, and check your technical method that you're using. So if you're using a laptop, make sure it's well charged, well connected to the internet, your microphone is working, that you've received the link ahead, all these stuff. Try to anticipate them and have a backup plan. Okay, right. I actually think there is something that I missed in the interview. Just a second, I'm so sorry. Right, how can I see my own comments? All right, sorry, I'm so sorry. If I remember it, I'll get back to it later. Oh yeah, I remember it. So in the interview, what they did mention in the website that they don't like people to speak about the interview after. So please do not share much about your interview, more than what you should, what is publicly known. Otherwise, you might be in trouble. Okay, so keep this in mind. Then after the interview, you will be expected to have your interview results, obviously. And this is according to the IMT recruitment timetable. We have it on the 27th of February, 2024. Results usually determine your appointability. So basically, let's say the total interview score is 70 and you scored 60. So that's a really good score, isn't it? So you will be appointable. You will be considered to have an IMT offer. And then you will have something else called the rank. The rank basically is your appointability versus the other appointable candidates. So if you remember, Reem said that we've got around 1,600 available IMT slots. So that's mean we're going to have around 1,600 appointable candidates. So you need to know where is your rank. Okay, so if you've done very well, you're the best, you're going to be rank 1. Okay. Remember, they will send you a detailed feedback regarding the assessment or the score of your interview afterwards. So if you think there's something wrong or something not fair, just get in contact with them, but they will put everything in details, really. And also they're going to be information in the website about how they, how the other candidates done and all that for your interest, if you're interested. Right. So are we all following? I'm so sorry, I spoke for a very long time, so I'm not quite sure if we're all following. Are you happy for me to go for the preferences?
Yeah.
Yeah, all right, thank you. So the preferences, right, okay. So preferences is the next step after your interview, and it simply means that you're going to arrange these 1,600 available posts. Now you're appointable, and now you have to arrange those posts in order to your personal preferences. They will invite you to do your preferences on Tuesday, 27th of February to Monday, 18th of March, 2024. It means that they will give you nearly 2 weeks to do this. What I really can say about this, I mean, from a personal experience, that is the most challenging and most difficult part in the application, and I did not anticipate that, because simply I didn't know it. I didn't see it coming. Like, I didn't thought about the preferences. I thought it was going to be very easy. So they were going to ask me, where do you want to go? And then I'll tell them where I want to go. But believe me, it's not like that. It's a very complex and time-consuming area. I'm not saying this to sound negative, but I'm just saying this for you to anticipate it. I'll try to give you some tips that eventually help me to make it through the preferences. So first of all, remember, these are personal preferences, which means it's all has to do with what you want, what you prefer, and what would you avoid. So do ask people. It's not bad to ask people to have a general idea, especially if you know some friends or colleagues who work here in the UK and would know better regarding the background of different preferences. But at the end of the day, you're the one to judge. Okay, you're the one to judge. There is definitely no right or wrong here. Right. I like to sorry, I like to do it in four broad categories. So you've got academic, geographical, social, and financial. When you do your interview, or maybe prior to that as well, try to plan early for your preferences. So think about what is your priority and what is your, the most thing that matters to you. Is it academic? Is it geographical circumstances? Is it social? Is it financial? For example, are you one who's keen to have a career progression in certain areas? So the site where, or the place, or the deanery where you have your training would matter to you, because if you do it in a tertiary hospital that supports, your specialty of interest, that would be better, for example. Or for example, if you're very keen about having a good teaching, a good training. I mean, training is more or less the same all over the UK, but again, there are slight differences between, certain trusts. So you might need to do a little bit of research, which is better and which is not better. So certainly, if this is the things that matter to you the most. Geographical preferences, so think about it, your location. So are you really concerned about where you will be doing your IMT training? Remember, 4 areas in the UK, each area got a lot of places with different, cultures, with different accents or slangs. Anyway, I'm sorry, delicate. So yeah, you have to think about it. Are you ready to be, do you want to be settled down during your 3 years IMT or your 2 years IMT, or are you ready to move? Because basically, so I don't know if you remember, I think Reem mentioned that briefly earlier. So in IMT, it's not like in Sudan when you do your general medicine specialization. So it's unified. It's a unified, sort of training for all the trainee. So all the trainee will be rotating through the same rotations. However, here it's different. It's different for every single individual or every single trainee. So for example, now I'm rotating different to what Reem is doing, to what Hala is doing. So the 1,600 posts, they're going to be very detailed, okay? So you need to think about, do you want to do your IMT in one city? Are you happy to do your IMT in one city and then move to the other city, or not? Do you want town versus big city, and then the living condition, the weather, the safety, the living expenses, the accommodation, the transportation, the school, the halal food, the social environment, the international medical graduate, is the international medical graduate friendly, or do you have any family or friends around to consider, Muslim or Sudanese community, etc. Okay, and then the financial, the last bit you might think about it is the financial preferences. So obviously the living expenses, or the cost of living, is different from one area to the other. All the IMT trainee more or less get the same income or salary, except the one in London, because London is very expensive, so they slightly get paid higher. So you need to think about all of that, what's really mattered to you. Because for example, if we say that you're someone who've got a family in Scotland and you only want to do your training in Scotland, you don't really care if the deanery is good, have a good reputation, bad reputation, you don't really care if it's cold, you don't really care if there are a Muslim community, or if it's expensive or it's cheap, it doesn't really matter to you, then that will make things very easy for you when you do your preferences on the website, because that means you will start by putting the Scotland post first, okay? So yeah. Now, why is it important to plan? So as I said, limited time and many posts, more than 1,500. So yeah, process in the website has limitations. And when I say limitations, these are technical limitations, and the way how you drag the posts, how you save them. So yeah. If you log in early and have a look early, hopefully you will work your way through it. But what you don't need to do, again, as I said, to just have a look maybe 5 days prior to the deadline, and then it will give you a lot of stress, believe me. Right, and the other thing that's important to remember, you can actually access the last year published posts in the website to get an idea. So the IMT recruitment website, there is a section called document library. So there you can find actually information about the last year posts. They will post them also. It will give you a better understanding about what to expect. I think Hala will put the link on the chat. Top tips again, download the list of published posts. You can download this from Oriel. So the preferences are done through Oriel. Sorry, I don't know if I mentioned that. Try to arrange and rank them offline first. Consider your ranking. Now, be mindful of your ranking because it's logical. So for example, if you got the first rank, okay, and you've got 1,600 posts to arrange, I think you've got already, you don't really have to worry about them because your chances of getting accepted in your 5, 3, 4, 6 preferences, are much higher. You've got the privilege, okay? So be mindful of your rank. So if you rank, far away, you might need to consider thinking about all these 1,600 posts, carefully. In red, I put it in red because it's very important. Do not put something you might decline, right? So when you put your preferences, say you've put the 5th preferences, but you weren't quite sure that, let's say it's in Scotland, but you weren't quite sure you will accept it if you get an offer, and then you will get an offer for that, and then you declined it. Congratulations, you've missed your IMT, opportunity, basically because you did not plan ahead, okay? Please do not put something that you will decline, okay? Try to avoid this because you will miss your opportunity. Remember your deadline. There's no excuses. If you do not submit your preferences before the deadline, that's it. Again, a missed opportunity. After ranking, you can download your own list of preferences and keep it aside if you need. Yeah, if you need. Right. Okay. The IMT offers, that's the last bit on my talk. So after the preferences, after you do your preferences on the 19th of March, then your offers will be released. So if you are appointable to have an offer, basically, they will send you that offer on the 19th of March. They will give you 48 working hours to respond. Okay, so it means that if they sent it on Friday, Saturday and Sunday, they're not counted. Okay, so Friday and then Monday and then on Tuesday, that's it, that's the deadline. So please make sure to respond on this period. It's a narrow period, so make sure to respond early. Obviously it's an offer, so you need to respond to that offer, and you've got 3 options. You either accept it, okay? If you're happy with it, you can accept it. If you're not happy with it and you think you can do better, in terms of if you wait, another offer will come, so you can hold it, or you can decline it, okay? If you accept your offer or hold it, there is always an option to upgrade it. And upgrade it may basically mean that, say for example, I've got an offer on my 5th preferences, but I'm very, very interested in my 2nd preferences. So you might say, yes, I accept this offer, but I would ask for an upgrade. An upgrade means that if the candidate who took my 1st offer or the 1st preferences drop out through the process, they will actually give it to you, okay? Or maybe other candidates according to the rank, right? Lastly, but not the least, remember the IMT offer is a 2-way process. They give you the offer, they expect an answer, and then they will say to you, yeah, we're happy. So make sure, you complete the cycle again with the emails and the Oriel account. Okay, that's the end of my talk, actually. We will open the floor for some questions now, if you're still awake. And that's going to be 10 minutes for questions. We'll try to cover as much as possible, but as I said, we cannot promise to answer all the questions, but don't worry, we'll try to revisit the post at a later stage. After the questions, I've got 2 slides, closure slides, and then we're done, okay? So thank you so much. So Hala and Reem, would you like to go live as well?
Sorry.
So do we have any questions? From my side, I can't see any questions. Guys, if you've got any questions, just put them on the chat bar.
There's no
questions.
I can't see.
Does that mean everything is clear or nothing is clear? Because it can be right. Okay. So we'll wait for 10 minutes anyway. It's your. Yeah,
we do have time for him. Is there any more links I need to put? I think we've covered all the links. Anyone wants an access to any of the resources we have mentioned? You can find the links in the comments part, and also after the record will be as a post, you will still be able to access these links.
I mean, I can't really see any questions, but
Yeah.
People from Facebook, from the viewers, I can see Hiba Mamoun and Ahmed Khalifa. They're both online, and they're one of the other fellow trainee. Ahmed is a senior trainee, actually. So I think, Ahmed, if you are actually, actively watching, and Hiba as well, and if you've got any comment on or anything to add, we'll be happy to take it now because we already have the time.
Yes.
Right.
I think you can proceed to the closure slides. And then
I think we can proceed to this closure slide, and
Yeah.
then if you guys have any questions, we can address them towards the end. Right. Okay. Let me, sorry. So, in summary, now we spoke about the whole IMT process. I hope you know that in order for you, so we said the IMT is the entry point, or the first point for you to get into an IMT training, okay? If you are interested in proceeding a career into medical subspecialties in the UK. So that's the training route, or the start of the training route, but there's always a non-training route. Now, this slide is about why IMT versus non-training route for medical specialties. So first one, IMT give you more support to transition for the medical registrar role. So you know that in IMT, you've got 3 years of training. So the first year and the second year, you are only expected to be performing as a junior doctor or a senior house officer level. So you not really have any registrar or senior responsibility. So this is actually really good because it will give you a good basic knowledge, and it gives you a good time to adapt to the system as well. The other thing is actually they do actually treat a trainee, or expect the trainee to be more keen for some reason, and then they feel more happy then to support them also in going to the registrar role. So the registrar role is either your IMT3. When you start your IMT3, actually this is a huge learning curve to you. So you will be expected to work as a medical registrar, but then they will treat you in a gentle, way, and then after that, you ST3 when you start doing your specialty training. The other thing, there is a very good trainee supervisor relationship when it comes to the IMT training. You will be having a clinical supervisor appointed and education supervisor appointed, and the education supervisor will be in charge of your academic progress. So that's really good. And also this academic progression will include a lot of opportunities like teaching opportunities, both local and regional teaching. They will give you simulation training, and they will give you some outpatient activities as well. In IMT training, or in a training route, you will be expected to have abundance of study leaves and study budget, which again would be in favor of your academic progression. The program is very flexible, so they do support less than full-time training and out of program training as well. So that's something really good. The last thing, there is always an ensure area if you to escalate your concerns anonymously. So towards the end of the training years, usually every year there is a national training survey, and they give the trainee the opportunity to respond to this survey, where they actually ask you questions about your training, and if you want to escalate anything. This is really, really good. From an IMG point of view, or with an IMG hat on, why I think IMT training is better from a training route is because it's actually not very difficult to get into an IMT training as an IMG, okay? So if you think about your eligibility criteria, GMC, as Reem said, is not needed by the time of the application. So if the application will start next week, basically in October, and then you will start your training in August, and you only need your GMC by August. So you've got enough time actually to get this GMC. So please don't miss the, you know, this opportunity. The other thing is the foundation equivalencies. They're really easy to be proved nowadays because the CREST form is not, you know, it doesn't have a tight criteria. So the consultant doesn't need to be in the UK. You don't need to have a prior NHS experience, and you can sign it online. You can scan the document, and then you can upload them. So it's a very doable. Nowadays, IMT as well there are more opportunities for IMGs to compete in the IMT post, because in the past the IMT used to be 2 rounds, but nowadays it's only 1 round. So previously the first round was only for the UK graduate, but nowadays it's only 1 round, which means anyone can apply. So you will compete either whether you are a UK graduate or a non-UK graduate. The last thing that I could have thought about in favor of the IMT training for the IMG was that your visa will be sponsored for 3 years. So that means you will be having more settlement. If you think about it, if you want to come to the country and then start having some NHS experience in a trust grade job or a non-training job, but and then after that apply for a higher specialty, let's say dermatology, with this experience but with no IMT route, okay, it means that you might just need like 2 years experience or 3 years experience. So you will really need to apply to the first job, have it done. Maybe it's going to be 6 months according to what you will have, and then you have to think about the other one. So there is a little bit sort of, you know, more settlement and, you know, stability when think about the IMT, because they will give you a sponsored visa for 3 years. All right. Now to add, also, if you think about the IMT, there are a quite high number of posts if you compare it to other specialities. So we've got around more than 1,500 posts. So your chances actually to get a training number is probably more than being hit by a car. But I'm not sure really or accurate about this study, okay? But yeah, I'm just saying you've got a lot of opportunities. More or less, it's the same job description. So as an IMT, you're expected to do the same job as the non-IMT, okay? So you're already doing the job, you might just also get the trainee title. I'm not trying to make it pinky or all good, but I'm just saying IMT is, there is a lot of good to the IMT training. With all of this being said, we don't know though to cover ourselves. So yeah, please don't come and shout at us. Right, we're done actually. Do we have any questions at all before we go to the thank you slide and the last slide? Oh, we do, I think.
We do, and I will post the feedback form if you can fill that for us, please. And also, there is, I think, one more question that we haven't yet answered about the CREST form. Yeah.
Yeah, so the question is, does the consultant have to have full MRCP membership? No, any consultant can sign the form. I've put the website link for the CREST form, the details about the CREST form and who can sign it, but it just needs to be a consultant.
And I think it's required to provide their qualifications, right?
Yeah, if it is not GMC registered, you will need to have the evidence of the signatory registration for the consultant.
Any other questions, you guys?
Did we say that the previous preference list is available in the website, in the IMT recruitment website, right?
Yeah.
For anyone to have a look.
Say that. Right. No other questions? Guys, are you happy for us to finish? Because I think we're running a lot ahead of time. Right. Okay. Right. So we've reached the end of our presentation today. So thank you for everyone who attended and interacted really. And we hope that we somehow help to make the IMT application process more clear for you guys. I've got 2 special thank you really. The first one is for my colleagues. Reem and Hala and Hiba, who was supposed to be here today but couldn't make it. But a special thank you really to Hala, because Hala is the one who actually planned for this presentation to occur in the first place, chose all the presenters, and she's done all the hard work. So really well done, Hala, and we truly appreciate it. The second thank you, special thank you, is for Reem Asmat. She's our moderator behind the scenes, and for Sajda, Sudanese Junior Doctor Association in the UK, for giving us the opportunity to present for you today. I will leave last word for Hala and Reem to share if they want to say anything. But just before that, if I can just ask you to kindly fill in the feedback form that we will put down on the chat bar. In this feedback form, there are going to be a box for suggestions if you need us to do any maybe future IMT related webinars. So just let us know, okay? Thank you so much again, and Hala and Reem, I leave it for you.
Thank you, Mona. Thank you. I think everyone did their best just to present and to reflect and to give part of our experience to help future candidates to secure and get their applications and get their training post. And ربنا يصلح إن شاء الله حال بلادنا، ونقدر نعمل كل اللي بنقدر عليه إن شاء الله عشان تكون عندنا بصمة ويد في إنه نصلح ونكون محسنين إن شاء الله. شكرا منى، شكرا ريم، شكرا ريم عصمت، شكرا هبة، شكرا for anyone who encouraged us to do this and who helped. Thank you.
I just want to thank Sajda for this opportunity. Thank you everyone, Muna and Hala, for your efforts, and good luck for all the applicants in the next rotation. Just remember, it will open in the next Thursday, 26th of October. Make sure you have all your required documents and evidence available, and good luck.
All right, thank you all. Ma salama, bye.